Welcome to the Women's Heart Health Summit. I'm your host, Dr. Mark Menolascino, Medical Director of the Meno Clinic in Jackson Hole. This is your chance to hear from international world experts on how to optimize your health, optimize your vitality, and prevent heart disease. We're joined today by Dr. Joel Evans, one of the leaders in functional medicine and women's health. And thank you so much for being here today, Joel.
Thanks, Mark. Great to be here.
Well, let me tell our viewers a little bit about you. You're one of the international world's experts and one of the teachers that I go to when I need information as well. Joel Evans, MD, board certified OBGYN and international lecturer, is the director of the Center for Functional Medicine in Stamford, Connecticut. He also serves as director of curriculum development for the Functional Medicine Coaching Academy and the medical director of KBMO Diagnostics. Dr. Evans was honored to speak at the United Nations on the topic of prenatal origins of violence, and he serves as UN representative and chief medical advisor for the World Organization of Prenatal Education Associations. His book on the holistic approach to pregnancy, The Whole Pregnancy Handbook, has received widespread critical acclaim. In addition, he's a member of the senior faculty of the Institute for Functional Medicine and the Center for Mind-Body Medicine. He continues to serve as the external lead in the Institute for Functional Medicine Advanced Practice Hormone Health Module. Dr. Evans is a founding diplomat of the American Board of Holistic Medicine and is recognized as the first physician in Connecticut to be board certified in both integrative medicine and gynecology and obstetrics. He has a special interest in breast cancer and is the medical director of Keep a Breast Foundation. He brings the latest information on cancer risk assessment and prevention to his patients. Dr. Evans serves as a peer reviewer for the journals Alternative Therapies in Health and Medicine and in Global Advances in Health and Medicine, and also a member of the advisory editorial board of the Holistic Primary Care. He's a former director of two nationally known organizations focused on pregnancy, and Dr. Evans helped to create a clinical study at Columbia University Medical Center on the use of the herb black cohosh, which was presented at the American Society for Clinical Oncologists. He's recently authored a chapter on nutrition and sociogenomics. He's pursued studies in spirituality, metaphysics, personal transformation for many years, and Dr. Evans has recently created a core curriculum designed to share ancient spiritual wisdom with others to help bring health and happiness into their lives. If there's anyone that brings the heart into medicine, it's our guest today, Dr. Joel Evans. Thank you so much, Joel.
Great. Thank you, Mark.
Well, you've really done a lot. You're doing a lot, and you have an insight in women's health that I've always appreciated. How do you get started when you have people come to see you? And is there a window that you look for as an opportunity to get started creating a relationship with your clients?
You know, that's a great question. And based on what I do, I already have a window in the sense that people are coming to me. So they're seeking something from me, and the burden is on me to find out exactly what they're looking for and then to be able to provide it. And so that insight comes from conversation, and a conversation where my patients can feel comfortable, where they can feel safe, and when they are relaxed enough so that they can access their higher self, so that they can really be sure that the questions they ask are the real questions they want answered.
Well, you work in a team approach, is that right? You have health coaches and others that work with you as a team, and do you find that more successful and enjoyable?
Yeah, because I find that working as a physician in a functional medicine practice, the doc can't do it all by himself, or the doc can't do it all by herself, or the nurse practitioner can't do it all by herself or himself. It really takes a village. And the reason it takes a village is because, as all of our listeners know and viewers know, the chronic disease burden that we're all seeing today, specifically heart disease, is by and large caused by lifestyle issues. And lifestyle issues are best corrected by lifestyle changes. And lifestyle changes are really hard. And
Mhm.
so it takes a team to be able to hold a patient's hand to find out the way language needs to be used, the particular goals, and to be able to make the patient feel supported. And I like to use the word loved. I tell my patients, you get unconditional love here, whether you do what we sort of agree the plan would be or not, you get unconditional love here. And that's what takes the team. So we have coaches. And, as you know, I am very much involved in the Functional Medicine Coaching Academy because I believe that if we're really going to make this movement to create health a reality and really have it spread and disperse through the world, it has to be taught in a collaborative way.
Well, that unconditional love and that safe place you provide in your clinic must really be a haven for people. And that allows you really to get at the root cause. You spend the right time with people. You ask the questions that they may not have been asked, but you listen. Do you feel like we've lost that art of listening, Joel?
Oh, we certainly have. And, there's actual studies and statistics on that doctors interrupt patients, within minutes, and that we are always thinking about what a diagnosis is as opposed to listening to what the patient has to say. And the studies say that if we stop interrupting with questions to get to the diagnosis, what we think is in a quicker way, if we let patients tell their story the way they want it to be told, that all those points that we ask about, they end up sharing.
Well, that's such a great way to think about it. And if you have a woman come to see you with fibromyalgia, you're not thinking about the diagnosis of fibromyalgia, but all of the different paths that can end up as fibromyalgia.
Exactly. So, we use this phrase, functional medicine is easy when we teach our functional medicine course, and the doctors and practitioners get 5 days of 10-hour lectures, 10 hours of lecture, and their heads explode and they're like, what do you mean it's easy? And it's really when we say it's easy, it's because we look at things, no matter what the presenting problem is, we look at things the same way. Because you use the word root cause, that's what we do. Functional medicine is root cause medicine. That's what I do. That's what you do. So we're looking for the causes of the imbalances that lead to the condition called fibromyalgia, because what's a condition is, as you know, conditional. So by changing the factors that are underlying fibromyalgia, we can help control it.
Well, Joel, as an international lecturer working with the UN, women from all over the world, the concept of holistic medicine, integrative medicine, functional medicine, how do you see them intertwined, or how do you define them when people ask?
Well, what I would say is the comedic way, the joke used to be that when you're a holistic practitioner, your patients have a whole list of problems,
Mm-hmm.
right? And but really, if you take that one step further, it's really looking at the whole list of causes that can be contributing to what their issues are. And that list becomes much broader when viewed through the when viewed through the functional lens than the conventional lens. So we look about stress. We look at things like, how are people doing spiritually? We look at environmental exposures. We look at prenatal influence, because what it's like for our particular patient when they were in utero being carried in the womb, that has an impact on adult health. And so I explain it in that way, that it's looking at all the different causes, and then we use all the different regimens. So it's not just medicine and surgery, it's diet, it's stress reduction, it's meditation, it's supplements, it's all sorts of things that are able to be used. And my criteria is, if it's safe and it works, why not?
We've talked to several speakers about these adverse childhood experiences and what happened as kids affect your adult health. But really what happened even before you were born in utero can affect your health outcomes as you age?
Oh, absolutely. In fact, I was at the same lunch table with the doctor that started that whole adverse childhood event study at Kaiser in San Francisco. Um, and, I said, listen, you do great work. I said, but you just started at the wrong place. And, and he actually heard my talk and agreed with me. Now, that doesn't take away from the fact that those adverse childhood events, as they were studied, do lead to all of these problems. But there's also this incredible body of literature about prenatal events leading to all of these problems as well.
And Joe, how does someone overcome those as an adult, those in utero, those childhood, those prenatal, postnatal? You see these patterns, I'm sure, in women later in life that are somewhat set up then. And how do you help them to shift them? It takes this whole person approach.
These are great questions, and I'm very excited about the answer, because this is what I speak about all over the world to opinion leaders. How do we change the world? And we change the world in two ways.
Please.
Number one is we stop as best we can creating the conditions that cause these imbalances. And basically that means taking better care or respecting our women when they're pregnant, and even going a step before to understand the importance of preconception. Preconception health makes a difference in terms of the in utero experience as well. So what happens to the mom when she comes in for a functional evaluation before she wants to conceive impacts the in utero experience of the baby. And that impacts the baby's health as an adult. So it's getting women to come in with their partners for preconception evaluation. It's having an understanding about the role of violence, which is all over the world and increasing, but specifically violence against women, and making pregnant women feel safe. I mean, here in the US, that is something that isn't understood by everybody, this feeling of not feeling safe. But when you go internationally, when you're worried about literally bombs exploding, going to the market and having gunmen just indiscriminate killing. So women not feeling safe from both random acts of violence, but also spousal or partner abuse, which is different in different countries internationally. So making women feel safe, doing a preconception visit, feeding them well, etc., are important things. Laughter, singing, song, music, all these things make a difference. So that's how we prevent it from happening. And then specifically to your question about what do we do when we identify these problems, is we share this information in a way that makes patients feel relieved and less self-critical. So for example, when I talk to patients about their in utero experience and maybe they have a short fuse or they're a little anxious and they feel that there's something wrong with them, that they're being overly critical, and I find out that their mom was abused by their dad while this particular patient was in utero, and I say, well, do you know that when your mom feels stressed, your whole hormonal axis, what we call the HPA axis, is programmed differently. So you respond to stress differently than the average person. So it's not your fault. Or women.
And Joel, this isn't just your opinion. There's studies that support this. This is good science you're talking about.
What I've presented internationally.
I love it. Yeah, it's so important.
Yes. And so they feel so relieved. They're like, okay, so I was dealt this deck of cards and it's not my fault. It's not my personality that is causing me these problems, but I came into the world predisposed to feel this way. So now I don't feel guilty. Now, what do I need to do so I can feel better?
Well, that's such an empowering message of understanding rather than a guilt message of shame.
Absolutely.
I've always loved when I listen to you speak about how you think so broadly, and you really think of women in the larger scope. And if we were just to take those suggestions into our world, what a
Right,
healthier place it would be for all of us.
right, right.
Joel, are there common patterns you're seeing today that you didn't see when you first started your practice?
Well, in terms of my patients, I'm seeing a lot more anxiety. I'm seeing a lot more depression, and I'm seeing a lot more fatigue.
Mm-hmm.
There's no question that that symptomatology is increasing. I'm also seeing an increase in women having challenging transitions through menopause. The symptomatology, it used to be that I fairly commonly would see women who I said, well, when was your last period? They're like 9 months ago. And I'm like, you haven't needed to come in? And they're like, no, I just stopped. And that's really now the exception rather than the rule. A lot of challenges with menopausal complaints.
And is there a way for people to self-help themselves as they go into the perimenopause? Obviously, how they eat, their exposure to stress. Are there simple things that women can do in that perimenopause time to make menopause not such a beast for them?
Yeah, for sure. And so this is, again, back to that, that aphorism, functional medicine is easy, because what you do for menopausal symptoms is like the same thing for fibromyalgia, right? So what I say, and it's really important, is we look at eating cleanly, trying to get sleep, reducing stress, fixing relationships, trying not to feel isolated. And you talked about a chapter I wrote on sociogenomics. Well, believe it or not, our relationships with others have a tremendous effect on our health and actually change the way our genes are expressed. So we can have our relationship makes us healthier, or relationships can make us less healthy. And of all the different emotions or relationships that affect our body, rejection, social rejection, is the worst for us. And unfortunately, that's becoming a more common theme in our society as people are becoming more divided as opposed to more united and connected. And so that's something that I talk about as well. But the piece here that I think is significant about menopause that makes it different than fibromyalgia is that women, as they're in perimenopause and menopause, are at a critical point in their lives in terms of dealing with and facing external stressors.
Mm-hmm.
Meaning, for the majority of women in midlife, they're dealing with children that are either applying to college, going to college, becoming teenagers. It's a stress about their children, while at the same time they're dealing with aging parents. And at the same time, this is classic when marriages run into trouble. So it's almost like a triple whammy of external pressure, and also a time when finances are challenging because of the costs associated with college or children growing up, and the costs associated with parents becoming ill. So it's a lot of external stressors, and that we know makes menopausal symptoms worse.
What I hear you saying is a lot of our women viewers are out there spinning these 6 plates, and it all goes well when they're spinning, but when one drops, they can all come falling down for them.
Exactly.
When you have your female patients coming in for the menopause symptoms, what are some of the easy things you can help get them started to do some self-care? Are there some breathing techniques, some easy nutrition starts? I know everyone asks you, Dr. Evans, what diet should I be on? Should I go into meditation? Should I go to yoga? Yeah, I know you have all these questions asked of you. Do you have kind of like a starter package you could share with some of our viewers?
So what I would say is the starter package is about categories. And then once you open that package, the specific item you choose is going to be unique to you. So for example, exercise or movement is critical. Some people would prefer yoga. Some people prefer walking. People want a kayak. Others want to dance and do Zumba. So it's finding something you like, because the literature shows that if you do physical exercise and it's something you like, the benefits far outweigh if you're doing something you don't like. So someone that hates to run, if I say run 2 miles a day, it's not a good thing. That's not a good thing.
And you talked earlier about this sociogenomics, and you talk about going running. You're better off if you go walking with your friend or a lover or a significant other. And this idea of epigenetics, the idea you can actually turn on and turn off certain genes that by the information you give them and the food you give them or the toxins. But you're also talking about these social cues to actually help optimize your genetic expression. Could you tell us more about that?
Sure. So we know that the most burdensome process to have going on in your body is inflammation. Inflammation causes every single chronic disease. It also causes the symptoms that people really suffer from. It causes depression. In fact, we're now looking at depression not so much as a neurotransmitter imbalance, but as inflammation in the brain. We're now looking at cancer as a disorder of inflammation. We know heart disease is not a disorder of cholesterol, but is an inflammatory issue. So inflammation is really an underlying abnormality for so much of what's going on with people, both diagnosed diseases as well as how miserable they feel. Well, the chemicals of inflammation, what we call pro-inflammatory cytokines, are produced based by chemical reactions based on enzymes that are coded for by different genes. So if genes are upregulated, they produce enzymes in greater quantity, and they then produce more end product. That end product being those pro-inflammatory chemicals, which then create more inflammation. So what I've found as I've studied this field of sociogenomics is that poor relationships, and I said the worst being rejection, upregulate all of those pro-inflammatory genes. So you make pro-inflammatory chemicals. So rejection is inflammatory. And that means if you feel rejected by your spouse, even, it doesn't have to be that there's a crowd of people that doesn't want you to be part of the crowd. It's about a simple thing. It can be something as simple as, oh, 2 of my girlfriends went to lunch and they didn't invite me. That thought makes you inflamed. And they need to know, like everybody needs to know that it's things as simple as that change gene expression.
And so can you do a self-talk that helps you to unwind some of that too?
Well, absolutely. Absolutely. So this is where I spend time with my patients, and we talk about concepts of, sort of what is it about that particular event that you find so hurtful? Has this been something that's been going, that is a wound from childhood, for example? Or is it just that you like this person and, that person has powerful friends that you'd like to get to know. So when they don't take you to lunch, you feel that, your professional growth might be adversely impacted. So there's different ways that people perceive the slight, or the slight is interpreted differently for everybody. So I try to find out, again, the personalization piece is key here, of what it is that is really the wound. And then we do corrective conversation so that we can heal the wound.
And Joel, this is not what they taught me in medical school.
Oh no,
How
oh
do
no.
you how have you gathered all this knowledge? And you're such a spiritual, heartfelt person, and what you're talking like a psychologist. And how did you develop these insights and skills? How do we get more doctors to think the way that you do and to communicate from a heartfelt place like you do? How do we get more of them to do that?
Well, what's nice is that Institute for Functional Medicine is training doctors to think this way, and we have,
You're right.
lectures dedicated to this. And then for my personal experience, I went through a training in mind-body medicine put on by the Center for Mind-Body Medicine. And so 20 years ago, I started, acting as faculty for Center for Mind-Body Medicine. And basically, the more work you do on yourself, the more able you are to easily communicate with others, and the more authentic conversations naturally become. It's not work. It just happens.
Well, authentic is the word I've always thought of when I think of Dr. Joel Evans, and the way you communicate these thoughts, and you think on a real global scale. And some of the comments you made earlier with your experiences with United Nations, with prenatal advocacy, how do we, as a country in the U.S., how do we get better at that? How do we help women? How do we focus more on this? The resources are so tight. Everyone's time is so short. The discussions are getting narrower and narrower. How do we bring this into a bigger forum socially?
Well, I think that, it's a medical imperative that we address these issues. And so what I do is, on the smallest level, I do it one patient at a time, which is how I interact with my patients. The next step is to train doctors so that they can then interact with their patients that way. And as you said, I do that all the time, all over the world, written a book. The next piece then becomes a social advocacy piece. And there are people that do that well. So there are many international organizations that are here purely for pushing forward that agenda, both in the US and internationally.
So I think about, as you're speaking, how much energy we put towards the flu vaccine to be sure people don't get sick from the flu. What if we put half that energy, and it's an important mission, what if we put half that energy into healing the individual, like you're saying? If we made that a public health initiative to start having these discussions and start talking like this. And I think it's going to take people like yourself and me and these type of summits to really get people to start opening on this discussion.
For sure. For sure.
I love the way you think about it's not so much where in a woman's, what time of life a woman has, but it's all these core deficiencies and core attitudes and lifestyle habits they can have, whether it's fibromyalgia, menopause, PMS. There's an epidemic of what's called PCOS and the insulin resistance that comes with that, and we tie insulin to heart disease. Can you share your thoughts about PCOS and help our viewers understand just a little bit? I know it's a huge topic, a big question, but how do you see it, Joel, and how do you explain it to your clients?
So PCOS is something that I see every day. And PCOS stands for polycystic ovarian syndrome. And I emphasize the letter S, or syndrome, because whenever we use the word syndrome, it means that there's multiple parts and multiple pieces, and things don't always fit together nicely. And part of what doesn't fit together nicely is we don't even have agreement on how to diagnose it. So there are different criteria from 3 international agencies on how it's diagnosed. And usually what it has to do with is some combination of not ovulating regularly, so you don't have monthly periods, seeing a lot of cysts on ultrasound, seeing an increase in testosterone or other androgens or male-related hormones. And whether it's 3 out of the 3 that are required or 2 out of the 3 required, that's the part that's debatable. But that's what happens. So you have women that are not ovulating, so they don't have regular periods. Their periods are lengthened, sometimes absent, and they have hair growth where they don't want it. And they are usually obese. And that is related to elevated insulin, which you touched on. So insulin, as you know, goes up when weight goes up. Insulin goes up with a diet that is not particularly healthy, but is filled with too much sugar, too much processed food, too much refined flour and grains. And so what happens is you get this imbalance in hormones. And the cause of that imbalance starts from either genetic, because there's a predisposition. It can start from an abnormality in the microbiome. So gut health, we now find, is a huge trigger for PCOS. So it can start with an unhealthy gut. It can start with, as I said, elevated insulin. So you have a trigger which usually ends up with elevated insulin, and elevated insulin affects a woman's body in almost every level. So what it will do is it will start working in the brain, and it will disrupt the normal pattern of hormonal flow so that the signals to ovulate aren't there. It affects the pituitary gland as well as the deeper brain hypothalamus, that's also affected. And then it actually changes ovarian production in the ovary itself. So the hormones that come from the ovary are different because of the insulin and the changes. And then ovulation doesn't occur.
So, Joe, how are you telling me, since this is a heart health summit, that you're tying the gut to the ovaries to the heart? There's some common thread for all these? Is that what you're suggesting?
That's what makes me smile, because those pathways, or I should say those connections, are what allows functional medicine practitioners in general, and what allows me specifically to help my patients so they walk out of here and they're feeling better and their markers are better, because the gut, we are learning, is one of the most important foundational organs of the body. And it's a foundational organ system that affects every other organ.
And Dr. Joel, how does an obstetrician gynecologist get stuck talking about the gut in his clinic?
It's because I'm an obstetrician gynecologist that understands functional medicine. So I understand the connection of the gut to almost every other organ system of the body. And so the gut, which is so important for digestion, also has other functions. It functions to modulate the immune system, as we know. It secretes its own messengers that can create inflammation in other parts of the body. It can affect the metabolism and digestion of estrogens. So it affects everything. As you know, the microbiome, as I said, with PCOS, but the microbiome also can give you an increased risk of breast cancer, all because of the compounds that are made by these bacteria in the gut. So the gut is critical. And when we're transitioning to the heart, the gut is critical for so many reasons, as I said, but when we're talking about inflammation and now heart disease being understood as a disorder of inflammation, people get gut inflammation from stress. People get gut inflammation from eating foods that they're sensitive to. People get gut inflammation from having chemicals in their food. They get gut inflammation from an unhealthy microbiome or the bacterial colonies in their gut. So all of that then leads to heart disease, which also can lead to breast cancer, which also can lead to fibroids, endometriosis, etc.
Well, I love the way you're able to tie everything together. And that's the sign of really an astute clinician, and the beauty of the functional medicine model is how you're able to tie it together. I would assume your clients, when they come in, like a woman with PCOS, they have 10 different paths to get there, and it may be 10 personalized ways to get out of it. So it's not a one size fits all, is it?
It's absolutely not a one size fits all. But in addition to sort of the unique personalization of what the treatments might be. So the treatment for one might be diet, supplement, stress reduction. And the other patient also needs diet, supplement, and stress reduction. I then have to personalize it even further by saying, what is it that you want your health for? And what is it that you're willing to do? Are you able to do all three at once? Or are we going to just do this in baby steps? Maybe somebody that wants the quickest route to feeling better, in which case you have to do more right away, or slow and steady wins the race for you. So we personalize it in terms of what we recommend and also how they choose to implement it.
You know, you're the first one of our series to talk in that way. We've had several people talk about a therapeutic phase, which is more aggressive and harder, than a maintenance phase, which is a little bit easier. And it helps people to do the heavy lifting in the first part, because that's the therapeutic phase. But I really like the way you laid that out. Is some people are ready and willing, have tried a lot to put more into it. Others, they kind of need a little bit of success to then do some of the heavy lifting. Is that what you see too?
Oh, absolutely. And admittedly, that comes from my perspective of why I signed on to be director of curriculum development for the Coaching Academy, because this is the key to working with people. And this is what I understood, because I found out about it organically from my experience. That's what my colleague Monique Class, nurse practitioner, found out about with working with her patients. And then when I found out that there's a whole profession geared to this, that gets this, I'm like, how can I sign on?
Yeah.
Right?
It's a great group of people in the Coaching Academy. And I know Dr. Monique, and the fact that you guys work together, I think the MD nurse practitioner relationship is a very healthy one for our clients.
Yeah.
When those two professionals work together, good things just seem to happen. You sprinkle in a couple of health coaches and anything's possible.
Absolutely.
That's great. One of the questions I'm sure you get asked every day is, Dr. Joel, what about hormones in my heart? Are they good for my heart? Are they bad for my heart? When should I take them? When should I not be on them? How do you personally think about hormones in a woman's heart? And I know it's individual, everybody's unique, but are there just some general rules you have now and some things that you're kind of watching to see how they pan out as well too?
Sure. So, the patient that you're talking about in your question is one that I'm going to say doesn't have pre-existing heart disease, hasn't had a stroke or a heart attack or anything like that, is just an average healthy woman at midlife and having symptoms and wants to talk about estrogen.
Exactly.
And so estrogen in menopause really is a balance between helping versus harming. And so the main harm with estrogen has to do with breast cancer. And then, of course, the help is with cognition. The help is with symptoms. The help is with bones. And significantly, the help is with heart.
Mm-hmm.
So the literature is pretty clear in being unclear. And what I mean is
Good answer.
that there are differing recommendations coming out all the time. And it makes me chuckle to read a document from key opinion leaders or organizations that say never use estrogen for the prevention of primary cardiac events or secondary cardiac events. And that's their conclusion. And then you read the whole paper and they go, however, if estrogen is started within 5 to 10 years after menopause, it actually can be helpful. So all the recommendations from all of the major organizations is you don't use estrogen for heart, and all the papers and all the fine print says it really can be helpful early on after menopause, which makes what I call biologic plausibility. Like, it makes sense. There are biochemical reasons why that observation makes sense, because estrogen relaxes blood vessels. Estrogen has an anti-inflammatory effect. We talked about the role of inflammation in heart disease. Estrogen is anti-inflammatory immediately after menopause, or in the first few years after menopause. Further on down the line, estrogen becomes pro-inflammatory to the blood vessel. So it's an antioxidant as well. So there's lots of biologic reasons why we see that observation. And then you have to balance it against the risk for breast cancer. So someone that's at ultra high risk for breast cancer, we have to really dig deeper to somehow quantify the risk for breast cancer into, high, middle, or low. And the way I think about it is in terms of hormones for heart health: red light, green light, yellow light. So green light is there's no risks, and then we have no problem doing it. Yellow light, we have to clear those risks, like you heard us talk about insulin. And, so do we lower insulin before we give hormone, or do we give hormone and actively, aggressively try to lower insulin at the same time? And then there's the red lights, the people that have, let's say, had a stroke or have had breast cancer.
Well, Joe, I think it was 2 years ago, I heard you use the green light, yellow light, red light analogy in one of your lectures, and I loved it. And that's how I think when women come to see me now. I see you
great.
and the stoplight, and I think, what color are they? And if someone comes to see us and they ask about hormones and they're lean and they do yoga and they have regardless of the other risk factors, but just as a person, if they're lean, they make good food choices, they balance their stress, versus someone who's obese, that eats fast food every day, doesn't exercise. The problem I have with our risks that we're taught is that we put everybody in that same bucket. And so if you're 400 pounds eating fast food and not exercising versus someone who's fit and eating organically, we lump them all as the same risk. And I think that's the beauty of the work you're doing. You're really looking at women and men and everyone as an individual. What's your story? What's your risk? And I hear people call that the N of one. Use the evidence and listen and look at all the data, because I know you're a teacher and a student.
Right.
You really research hard. You want to know all the data. But at the end of the day, you're treating the person in front of you. And that may be the most powerful thing of holistic integrative functional medicine, is that relationship.
Absolutely.
As we finish here, Joel, are there some words of wisdom you'd like to impart on our viewers, or are there some just go-to take-home messages that you like to share with everyone that you see?
Now, that's a great question that I've never been asked before. And what I would say is that I try to portray this message to my patients, that if they could somehow figure out the reason that they're on this planet, that once that's identified, and they can then try to bring things in to help them get there, that then the health issues will start to melt away, because it will be easier to implement whatever the lifestyle recommendations are that they're given. That's my own personal belief. Never read anywhere, never heard that before, but that's what I truly believe, and that's what I try to do.
And as you've always told me, is trust your heart, and I will. So Joel, I know I've really enjoyed talking with you. Thank you so much. And how do our viewers find you? How do they find you online and learn more about the work you're doing or connect with you?
Sure. So as you said, the name of my center is the Center for Functional Medicine. And so our website is centerforfunctionalmedicine.com. They can email me, joel@thecffm.com for the Center for Functional Medicine. So joel@thecffm.com. There's actual a new entity called Mighty Menopause that we're working on. It's mighty-menopause.com. Sign up for that, register, and you'll get all sorts of information as it comes out. And that's really the leading edge source of information for midlife women in perimenopause and menopause.
And Joel, what are you excited about for yourself coming up? What's exciting for you in your world and that you're looking forward to next?
Well, I love to go to India once or twice a year, and so I'm looking forward to that. I've got two sons that are really finding their dreams. My youngest just got into medical school.
Congratulations.
So I'm excited about that. And I got to tell you, doing what I just told you, I tell my patients to do, is find the reason you're on this earth. I'm constantly doing that work. And so being able to help with the food sensitivity testing and KBMO and identifying foods that cause inflammation, working with the coaching academy, all of those another genetics company that's coming out, called Toolbox Genomics, all of that work really makes me feel like I'm being of service. And that's really what I want to do, is be of service.
Joel, you're being of tremendous service. So Dr. Joel Evans, thank you so much for your time today.
Thank you.